Hey, this is Dr. Garrett Harper. Let's talk post-operative instructions after breast implants, right? This can be standard augmentation, this can be a mastopexy augmentation, this can also be implants after breast reconstruction, but there's a couple just kind of guidelines to follow to help you through it. So the timeline of recovery for almost any operation we do for 2 weeks, I need you to chill out. I don't want you to get your blood pressure or heart rate up too much, because in that amount of time for those 2 weeks, your body is actually kind of working internally to help any oozing or any bleeding that can go on. Of course, we never leave the operating room with anything remotely bleeding or oozing, but we also have you controlled in a situation where your blood pressure is whatever we want to keep it at. So if you go home and you're in pain, or you reach back for something, or you get your blood pressure and heart rate up a little bit too much, too fast, too soon, we can get into trouble. So what we always typically say is the guideline is the first 2 weeks, chill out. That doesn't mean that you can't live. It doesn't mean that you can't go to dinner. It doesn't mean that you have to stop being a mom. It doesn't mean that you can't drive a car. You can do those things so long as you're not on pain medicine. I just need you to not do anything that makes you sweat, right? That's when you kind of know I'm doing too much. That's for the first 2 weeks. Now, during that time, you're going to be wearing a supportive bra that we will give you. You take that bra off when you shower, right? We used to kind of say, wear the bra at all times, and then we realized we needed to tell people, not when you shower. You do leave your tapes over your incisions. You don't take those off for the first 2 weeks. We will handle the tape that is over your incision. It's okay if they get a little wet. You don't need to try to stand in front of the shower and celebrate it and get them as wet as you can, but it's okay for them to get wet. Let them kind of air dry, and then place your bra back on. Now, after surgery, you are gonna swell wherever we operate on. So if it's your breasts are gonna swell. So you're gonna wanna sleep in a reclined position. If you're not in that reclined position, fluid that is gonna be made in the area that we just operated on is gonna flow through gravity. So if your head is kind of below your breasts, if you're flat on your bed, you're gonna wake up, your neck's gonna be swollen, your face is gonna be swollen, your earlobes are gonna be swollen, you're gonna look like a bullfrog. So stay in that reclined position. It's great to kind of put some pillows on either side of you to prevent you from rolling over. Typically, your body is going to tell you that's not a good idea, but if you're the first night or two after surgery and you need to take a pain pill and that gets you really, really tired, you may not know. So it's best to try to kind of cocoon yourself for that first week until we see you. And then after that 1 week visit, we're gonna teach you how to use tape, and then you'll start applying your scar gel at the 2 week mark. At that 2 week mark, that's when you can get your running shoes on and start doing some light cardio in the neighborhood. Still don't need you doing burpees. I don't need you doing overhead smashes with your tennis racket or full swing in golf, but you can start getting your blood pumping again, which is great. Now at 6 weeks after surgery, you are 60% healed. At 8 weeks, you're 80% healed. So at that point, we feel like you can do pretty much whatever you want. However, up until that 6 week point, 8 week point, if week 2 is when you can start doing some light cardio and getting your blood pressure and heart rate up, and 6 to 8 weeks is when you can do anything, it doesn't mean that at week 2 and 1 day, you're doing a bunch of pull-ups, right? So you're gonna slowly progress, listen to your body, not do too much with your arms, especially in that first 2 weeks. I typically tell people, we've got incisions down here, and if you just put your fingers on your skin and bring your arm and elbow up like this, you'll realize that you put stretch on that skin. So if you're doing quick movements, not a good idea immediately after surgery. What I would tell you is slow and steady is the best. That way you can listen to your body and stop before something becomes painful. So that means in the first couple weeks, we're not doing any third base coaching. We're not doing any karaoke, Pete Townsend guitar riffs. We're not doing anything like that, right? We're pretending like we're in a London phone booth. And if we were really doing the funky chicken dance, you're gonna be hitting glass. So just keep your elbows tucked in. Even when you're in that shower on the second day, just kind of wash your hair and wash your body with your elbows tucked in. Once we're at that 6 to 8 week zone, no restrictions, live life, do everything you want. Those are your post-op instructions for breast implant surgery. Thanks.